Hey everyone, this is Rosalina.
And this is Shauna, and we're your hosts for Too Young for This Shit podcast.
This podcast is not just about boobs, but our journey with cancer. We are young millennials, open about giving you our raw and unfiltered look into our lives. We are in no way medical professionals, nor are we offering medical advice. Any medical references are cited directly from public websites or from our personal diagnosis. Some topics and stories may be triggering to those who are fighting, have fought, or have loved someone with cancer. So I had my 5th infusion today.
Oh, yeah?
Yeah.
How are you feeling?
Good. Tired. It's always the night before I'm going to have an infusion is when I don't get enough sleep.
I think that makes sense. Because I had like a total, I would panic before.
Yeah.
I don't panic these days now since I'm on Taxol. It's so mild and I know what to expect and it's fine. But when I was doing AC, I remember being like, almost like PTSD. Like I would be like super anxious. And then just knowing for a few days I was going to feel terrible and all the side effects that came with it.
Yeah.
How are you feeling otherwise? How's the hair?
So the hair is the same. So what they do with the DigniCap is they lower the temperature because I have, a few like bald spots. So it's not as cold. That's nice that I have that option. But yeah, my hair is basically the same. I do see some like baby hairs growing in, which is a positive, but I think I will start seeing results after chemo is finished because it's not, killing the hair cells.
Right. Yeah. And you only have one more to go. That's so exciting.
For some reason, like today, my 4th infusion was when I celebrated. I literally celebrated because I felt like I was over the hump and I felt so close to the finishing line. And I think also because my best friend was here, I just felt happier. With this 5th infusion, like I was happy that everything went well. But I guess I'm just indifferent about it because I don't know. I'm excited that I have one more to go, but my mindset is just let's go. I want to end this. I want to finish this.
I'm right there with you on that. Just get it done.
Yeah. How have you been feeling with Taxol?
I feel more like myself.
That is good.
Like I took a nap for the first time yesterday, just because I've been having some hot flashes. So like sleeping, it's been like, we're getting a heat wave here. So it's been hot.
Yeah.
So I haven't been sleeping well. So I didn't sleep well the night before. So that's, I think, the only reason for the nap. But like I haven't had to really slow down or like, it wasn't like I was in bed I feel normal, like completely. There's like no side effects. At least like
that's good.
my nails, my thumbnails have turned like a different color. And I'm starting to feel some neuropathy, which is starting to scare me a little bit. But it's like I'm having such a hard time icing them. It's so uncomfortable.
It is very uncomfortable.
I just like, honestly, I'm like, I do it for maybe like 5 minutes and I'll like get them off. Like I'm like get on a mat, like take them off my feet. Like I'm done. Like I can't. The head is enough, more than enough.
Yep. I like keep them on for like 5 minutes and then take them off and then put it back on 5 minutes. And then 30 minutes in, that's when I just give up and say, okay, I think this is enough.
Yeah. Well, you last 25 minutes longer than I do. I'm like, yeah. And I feel bad because anybody that goes chemo with me, like my dad came with me for the first time a couple weeks ago.
Oh, nice.
Yeah, he really just wants to like help me. And I was like, all right, you can come. Like I sent him the cold cap videos to help like, like show him what it was and how it like goes on my head. And luckily, like I've had this one nurse the last like few times I've gone who's been like amazing and like helps get the cap on and everything. So he wasn't like stressed out. But like I take my anxiety meds because now I'm done because I didn't have any type of reaction to Taxol at all. Bad reaction. I don't have to take steroids and I don't have to take
Benadryl.
Benadryl.
Wow, that is awesome. That is awesome.
Yeah. I asked for the no steroids. I feel better when I'm off
Yeah.
them. Like I mean, like I love being able to feel okay for those 2 days, but all the other side effects that come with it are just not.
So that means that your infusion is faster.
My infusion is now, I think it shaves off about like an hour and a half compared to the AC.
Perfect.
Mm-hmm.
Perfect. You're like, in and out.
Yeah. Yeah.
Yeah.
I had like a little bit of a scare too, because it's been, yeah, we haven't like really caught up. It's been like a month. To get I had a CAT scan.
Right.
I don't
Yeah.
think I mentioned last time that I was blacking out after my AC treatments. And it started off like where it was just, I chalked it up to like the cold cap being really cold, and then my the Benadryl, like all the pre-meds, and then I never remembered the ride
Hmm.
home. And then my fourth treatment, I had like major lapse of time where I have no recollection. And like for, a few days after, it wasn't like that same day as I'm coming home from chemo and
Hmm.
just out of it. So they ordered a CAT scan, because when you said MRI, I can't have an
Hmm.
MRI because of the expanders. So I had to do a CAT scan, and that came back fine. They think it was just a reaction from the cold cap and the AC. So that's good. So, and then I had to get an echo done on Monday,
What's an echo?
an echocardiogram in my heart, because I had to do it before I started chemo, because AC is like a really tough drug.
Yep.
Um, and it can like ruin your heart. So they checked before to make sure that my heart would be able to handle chemo, and then they check after to make sure it didn't get damaged. So that was good.
Hmm. That's good. That's good. Yeah.
Lots of just a lot of going on over here.
Yeah. I would say, like, there are some days that I'm totally fine, like, mentally, but I think the past few days I kind of got like emotional just out of the blue. It's hard because I think when you texted me about seeing all these posts of people who have like stage 4 breast cancer,
Ugh.
I think I kept seeing these posts just about like people having like a really hard time just having an infection, radiation was so bad, all those things that I kind of got like a little bit of
Yeah.
an anxiety from it. So
I yeah, I had a
yeah,
really,
that
I mean, I texted you. I had such a hard week that week, and I cried a lot actually, because like I said, I follow this girl in England who like is hilarious and has 3 kids, and she's 31, and um had a single mastectomy, and thought she was in remission, and it's in her bones now, and it's in her spine, and she's got a bunch of spots, and these spots were on her scans like from when she went through it the first time, and they just dismissed it. They didn't, like they didn't think it was anything, so they never even mentioned it to her. And now here she is, and she's stage 4. We really wanted to like make sure that we were really authentic. Like she's crying, like she's sitting there and being like, like it was so hard. I can't. And I love her stories, and she makes funny TikToks, and her hair is wild from going back from chemo, and she's got one boob with like a prosthetic that she's constantly ripping out of her shirt, and it's funny, and she's really funny. And then you get to see this whole other side of her, where she now is like, she's mentioned, what they've told their kids, and what, how her husband's dealing. It was, I cried to Matt about this. And I've never met her. I've never spoken to her. I found her like early on in my journey, and I just like liked her vibe, and this poor woman, and then I'm like, how do I know that my chemo is working? How do I know that there's like not other shit going on? Like I had scans earlier this year. Like, is this working? Like what, and then I was like, what if I'm stage? Like I had like a total, and it was like it's like all of my fears that are like very rational fears to have, I guess, throughout this journey. But I was being irrational, being like, I mean, it
yeah,
just
I
escalated
think
quick.
being in those type of groups, it's helpful, But I think there are times when I don't want to say toxic because I think that's the wrong word. I think it could really put a strain in your mental health. You know, not everyone is going through the same exact journey as you, and some people have it even worse than you do. So that part is just like so difficult for me to even comprehend everything, that these women are going through. All right. So this story is about me. So this is episode 3B. Kind of talks about just my plan, my doctor's appointments, and seeking second opinions. So let's start with, after I spoke with the head of radiology that day, February 25th, 2021, where he gave me the bad news that I have breast cancer. So he gave me the nurse navigator's phone number to start scheduling appointments. And let me tell you, everything went by super fast. When I received the call that day that I had breast cancer, Anna, the nurse navigator, she set up an appointment the following Tuesday, March 2nd, to meet with Dr. Perrin, the breast surgeon, and then also to do 2 different tests, a mammogram and an MRI that day. Mind you, that is only 5 days in between from the 25th of February to March 2nd that I was able to process everything before shit got real. Like, that's how fast these people work. And it's great. I feel like they are taking this matter seriously, but it's not good for someone who's being diagnosed with because this is a very shocking news and something that you can't process quickly. So it was just a roller coaster, but
I didn't realize that you went for a mammogram after. So they just gave you the sonogram. That was it.
They gave me, yes, they gave me the ultrasound.
Ultrasound. Okay.
And the biopsy.
Because when I originally had, for myself, it was, they wrote me the script, but they told me because it's a lump, they had to immediately do a mammogram. So that's the only reason why I was asking, like, if they had pushed you to do it that, like, they wouldn't allow me to not have one that day.
They wanted to do the mammogram to see whether the right breast was also affected too. With the MRI, they want to see, if there's any satellite lesions in my left breast or right breast, if there's any lymph nodes involved, etc. So that's kind of why they performed that test. My first appointment was with Dr. Perrin. And so I went into the room and she came in and she had 2 students with her and asked if they could come in. I kindly declined because I was already overwhelmed and I didn't want to have like 2 extra people that I didn't know and I didn't feel comfortable with in the room.
That's so valid.
Yeah. I want people who are listening to this, like, know that they can make that choice because this is your appointment.
100%.
If you don't want anyone else in that room, you have the right and the authority to do that. So Dr. Perrin and we talked about, my diagnosis. So again, I am ER positive, PR positive, have invasive ductal carcinoma. And then at the time, we didn't know if I had any lymph nodes involved. As far as visitors go and everything like that. At the time, the University of Washington of Medicine, they were pretty strict in having visitors. So my boyfriend can only attend via phone. I think it's super important to have someone there with you, even if it's just by phone, because you may not catch everything that the doctor is saying, or your partner, friend, parents, siblings, etc. Whoever you're bringing into your appointments, they can ask questions that you may not have thought of. So my boyfriend, Brian, was a great, I would say, candidate to bring to my appointments because he's the type of person that would ask questions. He asked a lot of questions, but he asked intelligent questions. So that's why I loved bringing him to my appointments. And I feel like he made things easier for me. We would talk about like what just happened. There are things that I didn't even catch that he caught. So,
well, because I don't know if you like I'd black out during like those meetings. It's just overload of information. You're
Oh,
not really
yeah.
hearing what you want to hear. You know, you're not getting the news and the information you like want to hear.
Mm-hmm.
So it's like I always like I'd have to leave and then be like, what just happened? And luckily I was able to bring Matt for my appointments, but there are apps on your phone that actually record your doctor's appointments.
My chart does that?
Not my chart. It is, I hear it all the time on the breast, like the breasties. I will get the app. We'll put it in the show notes.
Yeah. I would say another thing is that if you didn't catch anything, most doctors will, like, after you finish with your appointment in your My Chart,
Mm-hmm.
they would leave notes and like what they talked to you about. So I found that helpful as well. So like I went through and read their notes, and if there were things that I didn't catch that they said, they would actually write it in there. So that's another useful thing.
Yeah. Did you go in with like a list of questions from the internet like I did?
No, I didn't, because within
Yeah.
those 5 days, I didn't look up anything. I didn't want to look up
Oh, right.
anything.
This was just like a checklist of like what questions to ask your surgeon. So Matt printed it out for me, and I was like, thank God I had it. It was such a good check mark of being like making sure I covered and checked all the boxes. He had found it. I didn't know if that was like a big thing or not. I didn't, you know.
I would say it's definitely smart to bring questions in. I was doing that when I realized I understood some of the information that was giving to me later on, but when I first met with a doctor, I didn't do that. So I would advise people to do that. You want to ask the right questions because you're already overwhelmed with everything that's going on with you. But so anyways, so Dr. Perrin explained to me like my surgery options. We talked about having a single lobectomy. So basically, I'm able to keep some of my breast tissue, but just remove the tumor. Or she was talking about a mastectomy. And so in my mind, that time, I was against having a mastectomy. I found that to be more intense surgery, and then I needed to have drains, and like it's just this whole process that I didn't want. Like if I had the option to do a lobectomy, I'm going to take it. She also mentioned about having a genetic test. So that's just a way to understand if I have a mutation such as TB3, I believe that's what it's called, or like BRCA1 and 2. Because if I was positive for those mutations, then maybe I wanted to rethink about my surgery options, where a lot of people who are BRCA1 or 2 get the double mastectomy.
Yeah. And a hysterectomy too.
Or that too. Yes. Right.
Yeah. Okay. Mm-hmm.
Yeah. She briefly talked about hormonal therapy. She kind of mostly talked about tamoxifen, you know, that you take it for like 10 years, and that scared the shit out of me. I thought my treatment would be done, you know, after surgery if I didn't need to have, after radiation, if I didn't need to have chemo. But when I heard about hormonal therapy, that was the first time that I heard about that. So I felt like at that moment it was like never ending, where I need to continue living the life of a cancer patient. She had a booklet, and so she was kind of like reading through the booklet. And so she stopped at chemotherapy, and she said that we're not going to talk about this because there are no lymph nodes involved. You're, you know, stage 1B. So, you know, we weren't going to talk about it. And I was glad that she didn't want to talk to me about it, because I didn't want to talk about it. I was very, very, very in denial about chemotherapy. I wanted to put my foot down if anyone ever told me that I need to have it, or like very, very against it. But look what happened now. Lastly, we discussed about me moving to Southern California sometime in March/April, but wanting to have my surgery done here in Washington and then finish the rest of my treatment in Southern California. So after my appointment with Dr. Perrin, I trusted her, and I believe she was a good doctor for me. She was the
Mm-hmm.
only breast surgeon doctor that I met, and I felt great about her. But after her appointment, I had to go back to the UW Imaging Center, and then that's where I got my ultrasound and biopsy back in February. So this time around, I had to do a mammogram. Radiology assistant
Mm-hmm.
who's been through all of my appointments, the ultrasound, the biopsies, she was assisting me with my mammogram. So I was really ecstatic about that because I felt like, she was going through this journey with me and she was nice. I felt really comfortable with her. So, as Shauna mentioned in her previous story, the mammogram process is uncomfortable, very uncomfortable. But in that process, because I've seen this lady like all the time throughout my appointments, I trusted her. And so I kept telling myself that I was going to be all right.
They just don't like tell you how uncomfortable it is. Like nobody.
Yeah, they don't. It's
And
true.
I was thinking about this actually recently, being like, I mean, the gynecologist is not the most pleasant experience too, but like nobody talks
Mm-hmm.
about that either. So I was kind of like, okay, but like
Mm-hmm.
I wish somebody had warned me, because I just thought it was like, oh, you're getting some like pictures of my boobs. It wasn't like, no, we're gonna take that boob and then we're gonna like twist it and turn it in 40 different directions and we're gonna squeeze them over and over and over again. Literally thinking about
Oh,
it.
wait, I didn't get this type of imaging. We have to do it like switch her boob into this way. But yeah, they did both my breast.
Yeah, okay, yeah. I got both of mine done as
Yeah.
well when I went. Yeah. Mm-hmm.
Yeah. So after we were finished, I actually started crying. It hit me right then and there that this was real and that I had breast cancer. I did ask her if I was her youngest patient thus
Mm-hmm.
far, and she told me yes. So that like crushed me. I was in denial in the sense of like, why this young? Why am I getting breast cancer this young? Like, this is, you hear people having breast cancer at, you know, age 40 and above because that's when they say you need to have a mammogram. That's what I've learned. That's what I've learned about breast cancer. And so I never heard any stories of people having breast cancer when they were young. Now, being in this process and joining these Facebook groups, I understand that it does happen. And there were a lot of people who had breast cancer in their young 20s, but we just don't hear about them.
No, a lot of women in their early 20s, like a lot actually, are in those groups.
Those women who are now 40s, 50s that are still in the group and say that they had breast cancer in their young 20s and 30s. Yeah. I
Mm-hmm.
I was
Yeah.
astonished. Like I didn't know about that, but yeah, so
That must have been super upsetting,
yeah.
because we had talked about like being the youngest person in the waiting room and just feeling like you're don't belong here.
Or infusion center as well.
I see the looks I
Yeah.
get. I don't know if you get the looks too, because I have to see my oncologist like every other week before I go. And before I go downstairs. That's where I get my blood drawn and I get my port. They put my needle in, they leave the needle in the port, and I go upstairs and then they start the infusion. So I have it like, you could see it. It's in my chest and I have the thing. And I see women that look at me and you know what they're
Yep.
thinking. Like, she's so young. Like,
Yeah, I get this too. It's mostly like the visitors. Sometimes patient is sitting and so they're sitting on the opposite direction, but the visitor could see you walking by. And so yeah, I did get some looks. I started crying and I asked her if I was the youngest patient and she told me yes, but she informed me that she had someone in her family who was 30 and had breast cancer and she's a survivor now. So that really gave me hope and um, she hugged me as well. So I really love that because those are the moments where you need a stranger to just hug you. Like, nice to have hugs from people that you know, but when it's come from a stranger, like, I think that is 10 times better.
But also it's like, it's very genuine, you know, like,
Yeah.
it's like their first instinct is to like hug you and just say, you know, we'll figure it out. You're going to, you know, I hate that you're going to be okay thing, because it's like, you don't know that. So let's not say that. But like, you know, like you're going to get a plan and you're going to go through this and you're going to hopefully have a long, long,
Yep.
healthy, happy life after this, you know?
Later that evening, I went to get my MRI done. So when I went into the clinic, I didn't know the process of the MRI. I know that they take images.
Were you face down?
Yeah, I was face down.
Yeah. I didn't like that.
I didn't like it. Was so uncomfortable.
And then you're like trying not to move because you're like, if we move, we got to do it all over
Yeah.
again. So you're like, even breathing
Yeah.
was weird. And then it's
Yes.
the loudest machine.
Yeah. It was like kind of scary.
It's like, and it's surround sound. I feel like you're in there and it's just like, like it's just insane the noises that come from this one machine.
Did you had like headphones in where you can listen to music?
No, he gave me earplugs.
Okay.
Like he gave me like the little earplugs to just put in so that the noise didn't like bother me.
Yeah. I also got like headphones, like noise canceling, but
yeah.
I also got like earbuds where he asked me like what playlist on Spotify I wanted to listen to. So that was nice.
My radiologist that put my port in let me pick a playlist. We'll have to talk. We'll have to discuss our playlists on another episode, because I feel like that would be, I don't know, like curious what other, what's like people's like go-to. Is it a calming thing? Do you want to listen to like some real filthy hip hop? Do you want to listen to, like what are people listening to?
Yeah, right. So when I went in to get an MRI, they explained to me that they had to inject a contrast media. It's just a chemical substance that they use in MRI scans. And when they inject it, you know, it just improves the quality of the MRI images. But I don't know why I had so much anxiety about this. I was very concerned. They're putting something in my body that I don't even know what it is. And here we go. Like this fucking breast cancer shit. My mind went everywhere. I just felt like people and doctors and everyone are going to start putting shit in my body that I don't even know what it is, and that like I have to oblige to, because like what else am I going to do? So I freaked out. Definitely freaked out. But they reassured me that's gonna wash away.
Right.
If I drink a lot of water, it's gonna wash away within that day. So
I have a lot of drug allergies. So I had never had an MRI with, you know, let alone had to have one with contrast. So I had to make sure they had to like check to make sure that I was gonna not have an allergic reaction in the MRI machine.
Yes. No, that is actually really smart to ask, especially if you have an allergic reaction to it, because that's the last thing you want when you're like laying in there still
face down. Face down.
Face
you're
down.
already having a hard time breathing. Yeah. I know. Like,
and like I don't remember how long it was, but I think it was like 45 to an hour is the MRI. I'm not sure, but I just felt like
sometimes
it was long.
Like 25 minutes.
Oh, was it? Okay. So the next day, Wednesday, March 3rd, Dr. Perrin called me with the results of the MRI. So that was really fast. And she explained to me that I have satellite lesion cancer cells all around my breast tissue, but the main tumor looked slightly bigger compared to my biomarkers. So there were no lymph nodes involved. So that was a win. And I was super excited. I was like, okay, great. Like that's the least of my worries. Okay, that the tumor is a little bit big, but she says that she can still do the lumpectomy. And so we set a surgery date for March 12th. On March 4th and 5th, I did a consultation with medical oncologists and radiation oncologists to get a sense of what I should expect for my treatment, knowing that they won't be my doctors because my plan was to move to Southern California. And my experience with medical oncologists was the worst experience that I've ever had in the sense that she came in with a huge concern on her face. She came in, was asking me if I was okay. And then like every time she was explaining the process, she would stop and she would ask me if I was okay. So that just put me into a mood where like I was fine. When I walked into, the appointment, I was fine. I wasn't crying, but she made me fucking cry. That just made me feel 10 times worse.
Really?
Yeah, I didn't like it
I
at
mean,
all.
I feel like every time I went, like the first time I met my oncologist, like obviously you're getting upset. I went from the breast surgeon to the oncologist because they're in an office like literally next door to each other on the same floor. And, so she had caught me and I had already been crying from whatever else. And, so I think she thought I was just like this super fragile, I was going to crack at any moment, because like it was like 2 or 3 times that I met her that I had come in from my, getting news or this or that. And like, so she was, very comforting and like held my hand and like, I don't know. And I felt like, I don't know. I felt like she was just so gentle. And I think I like needed that. But then like when it came down for me wanting to be like a little bit more aggressive, like I want to know everything. I want like the good, the bad, like she wasn't that person for me, like that's when I started to have a hard time with her.
Yeah.
But I get it though also too. Like I mentioned that with when I met my breast surgeon, like she wasn't the warmest person, but I didn't need her to be that person for me.
I didn't want, and I think I was being very particular. I didn't want my medical oncologist to be the one who was empathetic. I already had my breast surgeon who was empathetic. And so the way that I look at it, and this is just my opinion, is I 100% have trust in the breast surgeon because they are the ones that are going to remove the tumor. That is the safest way to remove something out of your body that's causing harm. And so that's why, in my mind, the breast surgeon should be empathetic because, like, I'm trusting them with all
Right.
with my body to go in, open me up, take out the tumor, and then tell me that I have zero positive margins after the fucking surgery. With the medical oncologist, when the breast surgeon was talking about like the hormonal therapy,
Right.
chemotherapy, whatever, I think I already had like a negative
Yeah.
idea of who a medical oncologist is. And so, like, to me, no, this is going to sound bad. Like, I hated them. I hated them because, again, I'm the type of person that I would
Right.
like to know exactly what they're trying to put in my body. And I hate that.
You're here. I hated that you were there.
I hated that. Yes, I hated that was there.
And that was, I mean, that's really what it comes down to. Like, it was nothing personal against them. It was just like, you don't want to, like, you shouldn't be here.
So when she was being pathetic and like maybe cry, whatever, no, I hated that. So even my boyfriend was there and he thought that was a bad experience. What else? Yeah. So then I met with the radiation oncologist on the 5th and she was very formal and explained to me the step by step and that I felt comfortable with the information that she was providing me. So here comes the not so expected phone call on March 5th. It was in the evening, 7 p.m. Dr. Perrin called me and she notified me that they did a second reading of my MRI. Mind you, I didn't even know that was even possible that you have a second reading. Like someone else reads your MRI. I thought it just goes to one person and then like the supervisor and everything looks good, then that's the results. But no, that's not the case. Another person read through it and she told me that there were lymph nodes involved. My life was in shambles. That was having that phone call that you had breast cancer is like the worst. But the second worst is when they tell you something one day and then the next few days they tell you something else that completely, that is no longer in your control anymore. And now you have to
Right.
face with this reality that your cancer cells can be somewhere else. It could
I know.
go into your
Yep.
bones, your organs, your liver, like, all those things. So I was freaking out.
My MRI showed nothing. Nothing. You know?
Yeah.
But she, you know what, in my surgeon had said they could be, so that's why when they go in for a mastectomy, lumpectomy, they take your lymph nodes, they test them, because they take a few. They test them because there can be microscopic little speck of it, and it can, like, where like these machines can't see it.
Yeah. I mean, that's what our plan was anyways with the surgery, is that she was going to take a few just in case. But I was definitely shocked with that news. I texted my boss that evening and I told her I received really bad news and I need to take a week off from work. I needed to take a week off from work in order to process everything. And then in order to get all of my appointments done that week, because I wanted to, do things quickly, because that following week, that 12th, was supposed to be my surgery date. So Dr. Perrin wanted me to schedule another ultrasound on March 9th, just around my lymph nodes area, just to get a closer look into, if they see anything that's affected. So coming to March 9th, they did the ultrasound, but they surprised me with a biopsy. So they were like, okay, we see something abnormal in your ultrasound, so we need to do a biopsy today. And I hate biopsies.
I thought it was going to be so much worse than what it was. I was like pleasantly surprised. I mean, I guess like in the grand scheme of everything that's gone on the last 8 months, like, like I don't know, that is so minor, I think. So now maybe I'm just like, oh, it wasn't that bad. I think at the time I was like shitting bricks, but like it definitely.
I mean, yes, I do agree with you that you don't really feel anything. And if you do a slight bit, you just tell them, like, give me more of like the anesthesia.
The noise
whatever
is the worst, I think.
Yes, the
That
noise is the worst.
clicking
Yeah.
thing it does. That's definitely the worst.
Yeah. Yeah. The boob area is very sensitive part, and I think that's why I also didn't like the biopsy, because they're like touching it, and like, your boobs could hurt sometimes, and like even your armpit area too, that I feel like that's a very sensitive area. So I think that's why I didn't really like biopsies, because of that. Yeah, I cried during that biopsy because it was a shocker, and I was like, this fucking shit again. Like I thought I was done with a biopsy, but
yeah, I thought we knew everything that was going on.
Yes, but there was just still more unknowns, and it's just driving me fucking insane. So, afterwards, actually, my boyfriend Brian and I, we got Chick-fil-A, so that definitely was nice, because I really like Chick-fil-A.
Matt and I would hit Shake Shack and get milkshakes after every appointment.
I love Shake Shack.
I like their strawberry. I'm like not a big fan of the strawberry ice cream in general, but their strawberry milkshakes are unbelievable.
I need to try them.
And
milkshakes.
do it. I highly recommend. And I like the strawberry. I like strawberry way better than I like the chocolate. Normally that's like the go-to for me. But that ended up being like, it got to the point where like anytime we got bad news, or then it was like every time we were like going to appointments, so I was like, we have to stop. Like,
yeah, right. Like we need to
to
like,
rein it in here.
Do something. Yeah, we need to get food that we enjoy.
Yeah,
yeah. The first biopsy that I had, Brian and I went to go get ramen. Ramen is like our favorite food, essentially.
Yeah.
So, yeah, I would advise anyone who Like after appointments, just treat yourself to something that you love,
Oh, yeah.
whether that's food
Shake
or
Shack.
something else. Yeah, Shake Shack. Um, the next day, Dr. Perrin called me saying that the lymph nodes were positive. I think they took 3 samples and 3 of them were positive. So they wanted to get me a CT scan and a bone scan. So they actually got one for me, I think on the 11th or the 12th. On the same day, I got the CT scan. That one, like they inject something and like all of a sudden you feel like hot.
Oh, like I grabbed my, sorry, this is TMI. I grabbed my crotch to make sure that I didn't pee my pants.
I wanted to grab my crotch because it felt that way.
I just wanted to
it
make
really
sure
did.
that like something wasn't happening.
Yeah. Yeah, it was a very uncomfortable feeling, but I'm glad it didn't last that long.
Well,
I forgot.
did they tell you were going to feel like warmth?
When I got on top of the machine, that's when she warned me.
She warned me too. She said your lower half is just going to feel warm, but she didn't. Like I literally thought I peed myself.
Yeah.
Yeah.
Yes, and then after that, then I got the bone scan, and the bone scan was actually like pretty easy. It wasn't uncomfortable. They took like a few images, and I think it only took 15 to 20 minutes. So I got the results, I think the next day. So bone scanned looks great. They didn't see anything suspicious. The CT scan, they saw the lymph nodes involved, and then of course they saw like the tumor and the satellite lesion on my left breast, but no like organs or anything were affected. So hallelujah to that.
Thank God, yeah. That was a win.
Out of everything that could possibly happen, I would say that is a fucking win.
Yeah.
Yeah. The 10th and 11th, when I got the news of like the lymph node involvement and everything like that, lumpectomy wasn't a choice anymore. And so I told her, okay, fine, let's do like a mastectomy. And then she was like, okay, let me call some plastic surgeons and see if they could do reconstruction on Friday. Mind you, all of that is so quick, and I wouldn't have met the plastic surgeon. I don't remember what happened, but we canceled the surgery. And I'm happy that I did, because I think it's important to meet your plastic surgeon. It's very important to meet your plastic surgeon. I just felt like I needed, 1, to seek a second opinion, and 2, maybe like don't rush into things, because it's, again, my tumor is slow growing, and it's not that it's like super aggressive that I'm going to die in, the next few weeks or a month. Still had time to, wrap my brain around and have a plan. I booked a flight to Los Angeles on March 15th. And so I stayed there from the 15th through the 17th. On Tuesday, the 16th, that's when I met doctors at UCLA and then doctors at Cedars-Sinai. So I saw 2 different clinics, and then I wanted to make up my mind the following week. Someone from UW Medicine actually referred me to Dr. Baker. I met with Dr. Baker, really loved her. She is very knowledgeable, and I felt like I could trust her. She definitely told me I needed to do a mastectomy. For me, it was like, okay, this is my choice. And I think she's correct. The tumor in the scans looked too big, and there were like satellite lesions, and we want to be cautious. So I understood why she mentioned that. And I really liked, her whole entire plan. So I felt comfortable with her, but I wanted to meet with one other doctor at Cedars-Sinai, just to see if like what they say is different. But before I go there, Dr. Baker was smart enough to also include the medical oncologist so I can also see her. I saw Dr. Master, and, we talked about treatments and putting shit in my body and, all of that. Yeah. And, at that time, I was like, okay, this woman is smart and she knows what she's talking about. And she recommended that we don't do chemo first because she doesn't believe that the chemo is going to shrink an estrogen and progesterone positive tumor. I was on board with that plan. She mentioned that like chemo could be or could not be in the cards. It showed in my scans that there were 4 lymph nodes involved. So it just depends on the surgery and how many actually were positive. I met with someone at Cedars-Sinai, Dr. Chung, and she was so nice and so kind. But when I was in the waiting room, I waited a really long time. Like when I went to UCLA, I didn't have to wait that long.
I waited. I don't even think I sat down before I got called in for my appointment. Like they were like,
Yeah.
at NYU. Amazing. And then I saw the doctor at from my story from the last episode, like I saw the doctor who was amazing. I actually loved her. I wish that she would have been at NYU because I would have picked her as my surgeon. But I couldn't. It was an hour and a half wait. I'm in a gown. It's ends of January now. It was cold. I was like, I just want to get out of here. Like this isn't something I want to like be waiting,
Yeah, exactly. 100%. And so, waited so long. And then this person comes in. I didn't even know who she was. I don't remember what her name tag was, but she was kind of explained to me what she was seeing in the scans. She wasn't a doctor. That's why I know. I think she's like one of the nurses. And so she kind of butchered a lot of things. I didn't like that, like, she was the one who came into my room first and explained to me, like, all of this. It should have been the doctor first. So finally, the doctor comes in, explaining to me all this. We were asking questions, and I really liked her. I basically asked her, hey, can you recommend me a medical oncologist? I would like to speak to one too.
Yeah.
The next day, I met with Dr. Mita, and so she is the medical oncologist that had a different plan than UCLA.
Yeah.
Essentially, Dr. Mita wanted to do chemo first. She mentioned that she had some patients who were ER and PR positive that were able to shrink their tumor. And so all of the other doctors that I've met didn't mention that. They were saying, that it doesn't really shrink her tumor. And if chemo was ever in the cards, it would be after surgery. And so I was really skeptical. Like she was knowledgeable. I know that, and she has many years of experience, but I didn't want to be let down where if I chose her to be my doctor and then I had to do chemo and the chemo didn't shrink, then I felt like I was wasting my time. Because my number one thing that I wanted to do was to take the tumor out.
Right. Yeah, I'm I met a girl in my nanny group on Facebook who's going through the same thing we are, and she's she's early in the process, but they recommend she's doing surgery after, and she's ER/PR positive, HER2 negative. And I had asked, I was like, that's very odd because for like what you said, ER/PR, like our tumors don't shrink, chemo doesn't make them shrink. She's like, well, they want to make sure the chemo is working first, and I was kind of like,
that's what she mentioned. Yep. Mm-hmm.
yeah, like I was kind of like, oh, I don't know. I just almost feel like, is it a risk to keep it in there too? Like if imagine not getting that surgery, going through half your rounds of chemo to find out that now it's spread. Like I would be like, yeah, like you said, like get this fucking thing out of me.
Yes, exactly why I was terrified. And so I actually emailed her and asked her, do you have any studies that can prove your case about doing chemo first? There was like one study. The sample was small though, from what I was reading. I didn't have a good feeling. about it.
Yeah. You gotta go
Yeah,
with your gut.
I really had to go with my gut. But after meeting with both doctors at UCLA and Cedars-Sinai, I essentially contacted Dr. Baker's nurse practitioner. Can Dr. Baker talk today? I just needed to ask her like a few questions. And so Dr. Baker called me, and Brian was also on the phone. And we were just confused about what doctors were saying at Cedar versus like what she was saying. I was overwhelmed with all the information, and I kind of wanted to hear like Dr. Baker's plan again, because I felt like I was mixing information from UCLA and Cedar. So that I feel like, when you're thinking more than one opinion, I think that could happen for sure. Basically, we talked it out, and I felt confident in Dr. Baker. And, like each time I spoke to her, I felt more and more comfortable. And she also, which Dr. Perrin at UW didn't do, Dr. Baker wanted to take a punch biopsy on my skin because she wanted to know whether that
Oh yeah.
little bump was cancerous or not. So I went back and saw her on Wednesday. We performed it and everything like that. And on Friday, she called me and told me that it was cancer, but luckily it was the same type of cancer that I had in my tumor and in my lymph nodes, because she wanted to make sure that it
Like it
wasn't,
wasn't like a skin cancer or something
yeah,
else going on.
yes, or like, it wasn't a different type of breast cancer.
Like inflammatory where you can, yeah, you can
Yes.
get like, yeah, it could get messy.
Yes, exactly. I wanted to speak to the plastic surgeons now. So I spoke to someone at UCLA. My first reaction when I saw her was, wow, she's young. She's young, she could be like in her early 30s, you know, not to undermine, her intelligence and what she can do. I didn't know how much experience she had with like doing reconstruction for people who had breast cancer. We had a conversation of like whether to have the implant under the muscle or above the muscle, which like again didn't know there was these options. She was talking to me about like transferring tissues, like we were talking about like deep flap or taking tissue from your inner thighs or even like your lower back. And so she was kind of giving me all of that, but then also telling me about, I can get an infection and all the
Right.
cons to some of these procedures. I liked her. I just wasn't sure about her. So I saw two other plastic surgeons at Cedar because I still haven't made up my mind whether I wanted to go to UCLA or Cedar. These other folks were talking about like fat grafting. They were talking about,
Yeah.
we should do it above the muscle, where Dr. Slack was saying we should do it under the muscle. Of course, like the more opinions you get, like the more confused you'll get. I don't know why I do this to myself.
No, because it was the right thing to do. Like getting both. I mean, getting second opinions is the right thing to do. It makes you stand by your choice even more. Like once it's made,
Yeah.
like I
Right.
mean, I'm in love with the hospital I chose. My cancer center, every nurse, every like doctor. I mean, the phlebotomist that does my poor thing now, like chat with her every Monday. You know what I'm saying? I love everything about it. That it makes you stand by
I
your
was in
choice, you know?
contact with Jackie, the nurse practitioner at Dr. Baker's office, and I was like, is there another female plastic surgeon that does like reconstruction for breast cancer patients? And she said Dr. Slack was the only one. So I was shocked actually about that, but finally made the decision to choose UCLA was two things. I trusted Dr. Baker, like 100% trusted her in her plan. I thought she was empathetic. I thought she answered all of my questions. She really took the time to sit there and explain everything to me, which I really liked. You know, she chose Dr. Master as the medical oncologist. So I, you know, right off the bat, I was like, okay, if she thinks Dr. Master is a good choice, then I'm going to trust that. Not saying at the time, not that I didn't like Dr. Master, I didn't like the idea of a medical oncologist. So, and then Dr. Slack, you know, I thought she was kind, and I think I met her like 5 more times just so I can understand what her plan was, like all the questions that, you know, I've gathered just from reading her notes on my charts, from meeting with other plastic surgeons at Cedars. And then finally, because of Jackie, the nurse practitioner, where I can text her, I can email her, and she is so fast in responding and booking appointments that it was so easy to just get in touch with her. It was so easy. Then Cedar Sinai, I felt like I had a hard time like booking anything there.
Nurse coordinators are the actual angels in this
100%. When you're
process.
picking a clinic, you also need to see like the process of how they handle appointments, how you can easily reach people, because, you know, that's important.
Right. Is the medical app like
Yeah.
easy to use and, you know, kind of
Yeah.
navigate that? Also too, like picking a hospital, are you going to have to be running to different doctors in different locations at all times? Like, you know, like that was the one thing for me. It was like everything was in my one center. You know, I get blood work on this floor. I see my oncologist and my breast surgeon on the 3rd floor. 4th floor is imaging. You know, like everything is in the same building. My plastic surgeon is down the block, but that's in another NYU like building. But like I'm telling you, I don't have to ever like be running around going from my doctor's office then to an infusion center to then, you know, like it's just I go upstairs and that's it.
At the
And that was super
University of
important for
Washington
me.
of Medicine, the place was 30 minutes. So like each time I had an appointment, like I had to drive 30 minutes over there. Like, I don't know. For me, that wasn't ideal. But at UCLA, everything is like 10 to 15 minutes. UW just felt like a trip to get there. And I'm so glad that I decided to seek a second opinion and choosing UCLA. I don't have complaints about UCLA. You know, I met with Dr. Baker one last time. And so our plan was to do a single mastectomy. And she notified me that the satellite lesion was close to my nipple. She highly recommended that I remove the nipple and the areola. And so that was a shock to me. And I cried that day. Yes, another blow.
It was
And
another
it was
blow.
another thing that I need to be mentally prepared about. I'm not going to have any breast tissue on my left breast. Now I won't have any nipple or areola. And so, how am I going to look at myself in the mirror? Is what I asked myself. But she was certain that we needed to take that out. So I trusted her gut.
Will you do the nipple reconstruction, you think?
As of now,
Have you thought about it?
Now seeing my breast, I actually don't mind not having a nipple.
I don't mind it at all. To be honest with you, I never wear a bra. I never have to. It's amazing. That was like honestly one of like the pluses of this. I never have to wear ever again. That's my goal too. This is like once I get my, you know, my reconstruction like finished, like we're never wearing one again. Never gonna happen. They're like torture now. I put like wearing like a bathing suit top the other day. I was like uncomfortable in this. It was like, you know, a strapless one. I like want to just take this off. I'm like not into this anymore.
Yeah. I think the last thing I want to say is, I respect everyone's choice, whether they want to do a double mastectomy or a single mastectomy, but I chose a single mastectomy because, again, as I mentioned, the surgery was really intense. I had no idea how I was going to recover, whether it was going to be bad, whether I'm going to get an infection. How about when I'm sleeping? Is it going to be uncomfortable? And it was uncomfortable on that one side.
I
Yeah.
know. I know. And I had, yeah, I mean, I'm both. I mean,
Yes,
and I'm a side
also a
sleeper, so
side
that
sleeper.
was hard. That was like really hard 8 weeks of trying to figure out how to
And
like
also,
lay correctly.
you want to think about, do you want to breastfeed? If you ever want to have kids and a family, that's another thing to think about. I don't know, like for right now at least, I'm fine having one fake boob. That is my whole story about my plan and seeking the second opinion. And really, like, I even forgot to mention, like, I moved, like, after I met with people at UCLA, like, I moved the week after.
I can't even imagine like moving and then dealing with this. Like I mean, you're a superstar because I would have been a
Yeah,
disaster.
it was another thing to keep my mind occupied and something to look forward to. Yeah.
Mm-hmm.
Yeah.
That's good.
Hope everyone enjoyed, Shauna's story, mine story, and we're going to talk about, our recovery from surgery next episode. So stay tuned. Thank you all for listening to our podcast. Sharing our stories with you has been incredibly healing for both of us, and we hope it helps other women in their journeys through breast cancer.
Ladies, if you enjoy this episode, please share it with your friends. Help us reach more women by subscribing and rating us on Apple Podcasts and Spotify. You can also follow us on Instagram at TYFTS Podcast. Our email is tyftspodcast@gmail.com. We will link any resources from the episode in our show notes.